Hi, this is Joey with CodeRx. Earlier this year, we released the CodeRx drug database, which is useful for many different pharmacy applications, but one of the main ones is pharmacy analytics. And we've recently been partnering with a major healthcare analytics platform called Tuva Health to build data marts on their platform that integrate the data inside of the CodeRx drug database for use for things like population analytics. And so today, one of the use cases we want to present is a way to answer the question, which drugs are used to treat chronic conditions in my population? So to do this, we have to be able to answer three different questions. One is, what chronic conditions does my population have? Two, what drugs does my population take? And three, what are those drugs used to treat typically, which are referred to as drug indications? As you can see here, some of these are solved by Tuva, and other things are solved by CodeRx currently. So we're going to walk through examples and more detail of each of these things. The first question is, what chronic conditions does my population have? When we typically see claims data, what we get is ICD-10 codes. So just looking at raw claims data, the only thing you can tell is that 84.5% of my population has an ICD-10 code of I.10. Even if we pulled in the ICD-10 descriptions to these codes, it wouldn't get us where we wanted to be because there's a dozen or more ways to say hypertension. What Tuva does really well already is aggregate these ICD-10 codes into chronic conditions. So for all those dozen ways to say hypertension, we can aggregate that into the concept of a condition of hypertension. So after doing this, we can say that about 85% of our population has dyslipidemia, and about 85% of the population has hypertension. The next thing that we need to know is what drugs is our population taking. CodeRx, being a drug database, obviously can solve this pretty well. And so what we can do is when we look at claims for pharmacy claims, what we get are NDCs, which are national drug codes. These are not drug specific. They are manufactured drugs in a certain pack size. So typically there's going to be dozens, if not more, NDCs for a given drug. So we're just looking at claims data. The only thing we can know is that 26.4% of our population is taking NDC 680840511101. Using CodeRx, we can map those NDCs to drugs, and we keep this updated on a weekly basis because NDCs change week to week, month to month, all throughout the year. In this case, we're using synthetic data, so it's kind of a one-to-one NDC to drug mapping, but as I said before, usually this is like dozens, if not more, NDCs to a specific drug. But after converting it to drugs, we can tell that our population, 26.4% are taking simvastatin 10 milligram oral tablet. This is actually the relatively easy part. The next thing that we need to determine is, what are these drugs used for? What conditions do they treat? And for that, we need to know drug indications. So drug indications are things that drugs are used to treat. CodeRx drug database comes with a table called indications, where we map each drug to ICD-10 codes using a data set maintained by National Library of Medicine that we enhance to be able to navigate from a given drug to a given ICD-10 code. So in this example, lisinopril 10 milligram oral tablet has indications for things like heart failure and hypertension. We map these to ICD-10 codes because those are used broadly for a variety of use cases, but to solve our ultimate question, we need to map those back to conditions, which is where we, again, team up with Tuva to use that chronic conditions mapping to tie this all together. So going back to our original question, which drugs are used to treat chronic conditions in my population? The final reveal here is that we're able to use Tuva to figure out conditions, CodeRx to go from drug indications to drugs, and then ultimately we can go from conditions in our populations to drugs in our population. So an example of this, we zoom in on this table. This is the example of a finished data mart that you could use within Tuva, and it can take you from a condition to the drugs in your population that are used to treat that condition, and you could find an overall percentage of the population that is taking that drug for that condition. So for hypertension, you can see here that 166 patients are taking lisinopril 10 milligram oral tablet to treat hypertension or potentially treat hypertension, which is a 16.6% population total. Using this data, we can create visualizations like this that can show us quickly that a little less than 50% of our population is taking any drug to treat hypertension, which is a little bit concerning because we know that about 85% of our population has hypertension. So what are the other 30% using? We can even drill down into any of these conditions, such as hypertension, and see which drugs are being used to treat this condition. In this case, as we know, lisinopril 10 milligram oral tablet is used in about 16.6% of the population. Not pictured here, but we could also aggregate this at an ingredient level. So if you don't care about the difference between amlodipine 2.5 milligram versus 5 milligram, we could aggregate it to the ingredient of amlodipine. We could even aggregate it to, for instance, a drug class like ACE inhibitors versus ARBs. Going back to the big picture, this is everything tied together. As we can see, ICD-10 and NDCs being aggregated to conditions and drugs, and everything tied together with drug indications. If you'd like to book a demo to see this in action for our Tuva customers or anybody interested in Tuva, please head to tuvahealth.com. To learn more about CodeRx, please check out coderx.io. Thank you for watching.